on the news station. Good Day continues at 7:30 a.m. here on Fox 4.
And welcome back, 22 minutes away from 8 o'clock. Millions of Americans take prescription drugs for ADHD, but there are some new warnings to consider. We get an explanation from psychiatrist Dr. Rama Pemaraju this morning. Interestingly, these are stimulants that we're talking about for ADHD. Ritalin would be probably the most common example.
Ritalin is one example, but also dexedrine is one of the medications that's also in the class of amphetamines. And these two medications considered have some new warnings.
The FDA did not, however, see fit to issue what is called a black box warning. What's the difference between the warning that was issued and the rather dire-sounding black box warning?
The black box warning is the most serious warning to consider, but the FDA decided to place a general warning on the issues of these two medications.
Telling people about certain side effects, some of which sound very, very serious. And you always hear that, you hear the drug commercials, common side effects may include, and this long list of things that sounds awful. The question is, what are those side effects, and should they scare people away from using the medication?
They shouldn't scare people because every case and every patient is individual. But the take-home message here is that sudden death can occur in both children, adolescents, and adults taking these medications at usual doses. The main issue there, though, is those individuals have underlying cardiovascular problems, such as arrhythmias, structural problems of the heart, and so more caution is necessary when considering the use of these medications in these particular individuals.
So are doctors being told, for example, to give people, check the heart before you give a kid Ritalin for ADHD?
One of the recommendations is to take a careful history and physical exam before considering the use of these medications. But the interesting thing, too, is that they gave a warning about mental symptoms that can occur with these as well, such as new onset psychosis, or people who already have psychosis, their symptoms may be exacerbated or increased. Also, bipolar illness or manic symptoms can also be increased with the use of stimulants.
So what you want to do, particularly if you're a parent and your child is going to be taking this medication, if you're an adult, right, and your husband, your wife, your best friend is going to be taking this medication, you want to watch for and be aware of watching for some of these symptoms.
There's no question that stimulants really have efficacy in the treatment of attention deficit hyperactivity disorder. And so really you have to always weigh the benefits and the risks with your physician and really consider the fact that you will get benefit if you indeed have attention deficit, and regular monitoring and responsible care is what the take-home message is here. You want to also be careful because that underlying structural problem of the heart, if there's a history of that, then more caution is warranted in that way.
So perhaps if there's a family history of heart trouble.
Yes, including a family history. And in adults, they also warned that there's more predisposition to stroke, heart attack, because adults have more underlying problems than kids can,
right?
Because of the age and where they are.
Right. So really, what this does, and you hear about a new warning on these medications from the FDA. Really, what the FDA is saying is talk with your doctor.
Absolutely, and take the appropriate actions necessary for your individual case.
Okay. Dr. Rama Pemaraju, as always, thanks very much. We appreciate it.
Thank you.